welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Stroke is a leading cause of death globally and the primary cause of disability in the developed world. Ischemic strokes account for 80% of stroke cases, where the cause is a blood clot obstructing the supply of oxygen and nutrients to the brain as a consequence. The World Health Organization puts the figure of those who died from stroke globally in 2012 at 6.7 million. According to the Centers for Disease Control and Prevention, the risk of having a stroke depends on race and ethnicity. The risk of a first stroke is almost twice as high for blacks as for Caucasians. I have two guests on the show. Professor Abiodun Akinwutan, a professor in physical therapy, neurology, and ophthalmology based in the University of Kansas in America. He is appointed to the U.S. National Transportation Board's Committee on Simulation and Measurement of Vehicle and Operator Performance. Dr. Ronke Esho, my second guest, is a specialist in physiotherapy and occupational health at Ronke Esho and Company, as well as the Physical Therapy Center in Lagos. Dr. Esho is a member of professional organizations and regulatory bodies in both Nigeria and the UK. You're welcome to the show.
Thank you very much.
Let's start by talking about some of the risks of having stroke. The statistics say, people of color, black people, are more likely, twice as likely, to get a first stroke as Caucasians. So what are the risks we should be looking at? So
there are what we call the modifiable risk factors, and there are the non-modifiable risk factors. The non-modifiable risk factors is where race comes in. There is age as well. There is gender as well, and there are family.
So who gets it more, the man or the woman?
The woman gets it more, because the woman lives longer than the men. A good number of women are on birth control pills. They tend to be more on hormone therapy, and postmenopausal women are also at high risk for a stroke, and that explains the gender difference between male and females. But these are non-modifiable risk factors. Medical conditions such as diabetes, hypertension, and congenital heart problems also increases the risk. But what is more, for me, important are the modifiable risk factors.
I guess that's where the prevention comes.
And that's where
people
the
can do
prevention
something
comes in. Yes.
about it.
Yes. The modifiable risk factors are things like physical activity, being engaged in activities that are physically challenging, diet control, cessation of smoking, and moderation of alcohol intake.
Mm-hmm. Okay, Dr. Esho, so let's just say somebody, is not watching all these things, has a stroke, and is taken to the hospital. I want to know, are there things you do to help you know how well this person can get back into society, be useful to himself, herself, and probably the society?
First of all, I'm delighted to be here. I think the Professor Akinwutan should actually take that particular question because he is qualified actually to deal with intervention at a very early point of contact. And then I will come in when it comes to return to function, return to the environment and things. I'll defer that to him.
Okay. She mentioned early point of contact. Is this significant?
It is very significant. As a matter of fact, the first 72 hours, the medical care you receive the first 72 hours after stroke onset is very critical and highly indicative of what the prognosis will be going on from then. But when patients have survived a stroke, Then comes the acute management, which is usually within the first 4 days. And that is very important because it's usually in the hospital. Those who have been hospitalized have shown a better recovery than those who have not gone to the hospital. And this is because in the hospitals and in specialized subacute care facilities and eventually rehabilitation facilities, there are places where you use what we call objective measures for the evaluation of the deficits that are stroke related and coming up with evidence-based methods that have been identified in the studies as effective for overcoming or helping to recover from the deficits experienced after the stroke.
Okay, before we go into specifics, you spoke about the first 4 hours, the
first 72 hours.
72 hours being critical.
Yes.
That brings into question, what do you see when someone is having a stroke? How do you know this is a stroke patient?
Exactly. Because within those 72 hours is the most critical 3 to 4.5 hours after stroke onset, when a treatment is possible that can almost reverse the effect of the stroke. And how do you identify if a stroke is occurring? There is the simple method called the FAST method, F-A-S-T. The F refers to the face. You tell the person to make a smile, and if there is a facial drooping or the face drags to one side or there is something funny about the face, that's the first indication. The second indication is the A, which is the arm. You ask the person to lift up both arms. And when one goes higher than the other, it's a sign of weakness on the lower one. And the S is speech. You tell the person to make a sentence. Usually there is slurring of speech. The sentences don't come out clearly well. Once you observe these 3 major symptoms, you need to act fast and get the person to a medical facility as fast as possible. I am not sure how many facilities in Nigeria are adequately equipped to determine which patient will benefit from what we call the magical treatment, which is the administration of a transplasminogen activator. I know there are a couple of centers in Nigeria that do that, but the most important thing is once you observe these 3 symptoms, get your relative, get your family member, or get the person to a medical facility as fast as possible.
Okay, so let's bring this home as much as possible. I believe that the first thing you would notice is the slurring.
Okay.
Maybe
Or the
when you're
face.
talking,
Or the facial,
yeah.
facial
you're
drooping.
facing mama now or
Okay,
papa,
yes.
and he's not looking too okay.
Yes.
Is he looking sleepy? Is he falling? I imagine that if he's talking to you, you could find out.
Well,
or can you actually see the face droop?
Yes, you can. And it's going to be like, Mama or Papa, why are you winking at me?
Okay.
Or why are you twisting your mouth to one side?
Okay.
Or why are you blinking on just one side? And that's what actually triggers the sentence response. And when they try to explain to you, they go...
Then you hear the slur.
Then you hear the slur. And you go like, oh, Mama, Papa, can you raise both hands? Sometimes it's also difficult for them at that point to understand what you're saying. Once you've seen the facial droop, and once they start to talk to you and you notice the slur, act immediately.
You have to act immediately.
Immediately.
You don't begin to guess. Could
You
this
don't.
be a stroke? Okay, maybe she's just tired.
Don't guess. The cost of guessing is just too much. You would rather be told in the hospital it is not a stroke if you get there so early than be told after you get there so late that it was a stroke.
And
the
most
damage is
family,
done.
sorry to come in, but most family actually know when something's going wrong with that family member. They know something's going wrong. They just can't put their finger on it. So he's just suggested that just go through that checklist and see, whether my fears that something is going wrong, something really is.
Okay,
And
so
then,
we
yeah,
go through the checklist of FAST.
That's
Yes.
right.
Facial expression or facial droop,
Yeah.
the arm drift,
Yes.
the what's it?
Slurred speech.
Slurred speech,
And
And
timeliness in acting.
Okay, that
Fast.
timeliness is for you.
Yes.
Get up and start moving. All right. So this patient has suffered a stroke. What is the likelihood? Because we always hear about a second stroke. Must we hear about a second stroke? What is the likelihood that there's going to be a second stroke?
Well, the chances of a second stroke is really very high for someone who has had a first stroke, except for those who are lucky to receive the adequate medical treatment that reduces those risk factors that precipitated the first stroke. If it's a blood clot stroke, which we call an ischemic stroke, there are still several other blood clots traveling in the bloodstream. So the first one is just a clot that got clogged in one of the blood vessels. There are still several others, if not treated, that will clog other vessels and even result in a second, third, fourth, or fifth stroke, which usually are fatal.
Okay, we really have to go on a break now. When we come back on the break, Dr. Esho, I have to get something out of you. And we'll get something out
I
of
thought you
you
had.
too when you call in after the break in a minute.